So, as promised, it is 6:02. Thank you all who are currently on the call, and we're definitely expecting for more folks who may not have been able to jump on exactly at 6 to join us as well. My name is Fabrice Jewin. I am the project manager for the local office on Minority Health. I want to thank you for joining us for this Minority Health Month 2021 initiative. A community forum with our local LGBTQ community about COVID-19 and the crisis, its impact on the LGBTQ community, as well as vaccination sentiments overall. Here at Public Health, we have made it our goal to not just provide vaccination opportunities to our county community, but to also make sure we are empowering and informing folks with the knowledge they need to make the best decision for themselves and those around them. And in this instance, we want to make sure we give due attention to our LGBTQ neighbors who, may be either on the fence or hesitant about the vaccine, but also to make sure that some of our local leaders get a chance to kind of address the impact that the COVID-19 crisis has had on this demographic group. So thank you again for joining us. That's all you're going to be hearing from me for this webinar. We have an amazing panel of experts, leaders, and just folks who have their ears to the ground for our local LGBTQ county residents. So I will pass the mic over to the Executive Director of the Greater Dayton LGBT Center, Randy Phillips. And once again, thank you for joining us. And I definitely look forward to this, what's expected to be a really great conversation. So Randy, take it away.
Thank you, Fabrice. Like you said, I'm Randy Phillips with the Greater Dayton LGBT Center. The center's been in existence here in Dayton for over 45 years, serving the LGBTQ plus community. And tonight we have the privilege of having a number of guests on our panel. I have Nicholas Brown, who is a third-year medical student at Wright State University, Boonshoff School of Medicine. He currently serves as secretary for Boonshoff Pride and will serve as vice president in the next academic year. And of course, a longtime Daytonian. Nicholas, you got anything you want to say?
Not really. I'm just glad to be a part of the panel and look forward to helping out anybody in the community who's on the fence about COVID vaccines.
Awesome, awesome. Also joining us is Melissa Rodriguez. Mel is a retired veteran of many years. I'm not even sure how many, and is also a community advocate as well as a leader on Rainbow Alliance as well. Melissa, do you want to add anything or tell us anything more about yourself?
No, thank you. Yeah, I'm also the member of the Public Health, LGBTQ Public Health Alliance, like Randy mentioned, and also on the board of Rainbow Elder Care in Greater Dayton.
Awesome. And last but not least is Dr. Aaron Block, who is a family physician, in fact, my family physician, that currently practices health with Premier Health Network. He's a graduate of the University of South Florida and both an MD and Master's in Public Health Education, or public health degree, and he completed his residency at Good Sam here in Dayton. In addition to practicing primary care, Dr. Block also sits on the Board of Health for the Dayton-Montgomery County Public Health Department and is a clinical associate professor at the Department of Family Health at Wright State University's Boonshoff School of Medicine. Dr. Block, the audience is all yours.
Fantastic. Randy, thank you for the introduction. Yeah, my name is Dr. Block, and I'm really happy to be able to speak to you guys in the community and help clear up some concerns and questions about, COVID vaccination. And obviously, we've got a really great panel here tonight to really help to that point. One of the things that we wanted to announce right now is that we have actually, through Public Health, created an LGBTQ COVID-19 vaccination clinic where it will be on Thursday, April 22nd from 8:30 in the morning till 11:30 at the Dayton Convention Center, which is 22 East 5th Street. You can come and walk in. You don't need an appointment for this vaccination clinic. It will be all Pfizer vaccinations. So that is one of the 2-step vaccines. And no insurance is needed. We just want people to get shots in arms and get protected against this pandemic so that we can be done with it.
Absolutely, because as we move forward, even into our Pride season, the more that we can, more folks that are vaccinated, the easier it's going to be for all of us in general.
Mhm.
From what you have observed, as far as the panel is concerned, from what you have observed, how has the COVID-19 crisis impacted the local LGBT community here in Montgomery County?
So, like other minority groups, people of color and people of other ethnic backgrounds, the LGBTQ group as a general has been subject to systemic discrimination, especially in medical care, which is not easy for a lot of traditional physician groups to talk about until more recent times, where there are quite a few of practitioners, physicians, nurses, PAs, nurse practitioners, where we actually are part of the community, as well as others who are a lot of aides and people who, really pull for all of the minority groups and equality. Um, just until a few years ago, actual, homosexuality was considered pathologic or an actual disease of the brain. And traditionally, LGBTQ individuals have been rejected by the medical system and treated poorly. Plenty of patients that I have who have had, a lot of life experiences have shared some really heartbreaking stories with me, which, even more fuels my efforts to kind of help bring about some change in healthcare. But these individuals have been neglected, felt like they were outsiders and not important. And as such, a lot of LGBTQ individuals are fearful. They're fearful that they're going to be judged or not understood. And so, because like other minority populations with similar feelings, these are individuals who don't seek care as often. They also tend to have, lower socioeconomic status. So they tend to have jobs that maybe pay less because they have less opportunities that they come from. And they oftentimes, don't have access to healthcare or a provider that's caring and understanding. They don't have access to obtaining masks and hand sanitizers and any other protective equipment. Oftentimes they're also working jobs that are more frontline. So they're working in food service or retail, and they have a lot more frontline exposure. So because of this history of, mistreatment from the medical community, I think a lot of LGBTQ individuals may be fearful of the vaccine and distrusting. So that's why it's really important, part of the reason why we're here tonight, to help extend a hand of support and repairing the trust that's really needed to help move the vaccination effort along.
But I think as far as uh, we've made great strides in that in many respects. I mean, even here at the LGBT Center, even tonight, we're holding a health clinic to allow people who may be underprivileged to be able to come in and access those things, whether it be sexual health or just general health care. Nicholas or Nick or Melissa, have you observed anything that you would say has impacted the LGBT community specifically?
I can touch on it a little. I know some of my friends and colleagues, especially in the LGBT community, focus a lot on social interactions and gathering together face to face. And of course, that's been hard for everybody. But for us in the minority groups, it can be a little bit more difficult to find the support from individuals over a virtual field, as opposed to gathering in enclosed spaces and face to face, especially for people who may not be out of the closet or open with their family and friends. So that has been rough on some people, but we're definitely all here still supporting each other, even if it is from afar.
Yeah, one thing I've seen through Rainbow Elder Care, especially at the beginning, was just access to, especially in the elder community, LGBTQ community, being able to have access to some of the resources like food, like the food banks and different resources, and not wanting to go out. So just making sure that that mutual care of food insecurity was something we try to help with.
And there are resources out there for those that are having those kind of disparities, even those that, as some have already mentioned, that there is a lot of virtual medical that is happening, and it's and with that is also created a digital divide to where some of those in the lesser economic situations may not have the electronics to be able to meet electronic counseling or those kinds of office visits that we're seeing on the rise during the COVID situation. But we're even making strides to bridge some of those gaps. There is funding out there that even here at the center that I've gone after to try to help bridge those gaps for those people who are separated by that digital divide. But there are resources out there, and of course the center still publishes that resource guide each year that lists those doctors, lawyers, therapists, clinicians that can actually help in those kinds of situations. Are there any other unique struggles among the elderly community that you've experienced or that you're aware of?
Yeah, I'll go ahead and start with that. One of the things that we've been concerned with and focusing on, especially in the elder community, has been isolation. So that's been a problem in general in the LGBT community globally. There's 2.7, for instance, in the United States, 2.7 million people over the age of 50 that identify as LGBTQ, but they're also more likely to live alone or have a lack of access to the elder community was already more susceptible to serious cases of hospitalization, and also access to end up being in critical care or dying for it. So the death rate was already there in general. So compounded with the lack of access to healthcare, potentially in the LGBT community, access to secure housing compounded some of the stuff, even here locally. And then you add the history of, like Dr. Block talked before, the history of distrust or in government and in the healthcare community, going back farther to the Stonewall riots. The one thing I heard from a lot of the elder folks I talked with was, it's like HIV crisis. They're having like traumatic experiences and thoughts of seeing their friends dying during the HIV crisis, and then seeing this COVID pandemic where you're relying on the government to come up with something. So that early on in the elder community seemed to be bubble up a lot.
Have any of the other of you two experienced or seen any of this in your practices?
Yeah, I mean, with the elder population, we see more people on fixed incomes with limited support structures. Major, one of the most challenging things for me where my practice is out in Franklin is, transportation. So, if they don't have the physical abilities to drive anymore, we don't have very easy, public access out to where I'm at. So yeah, it very much makes it a lot harder for the elder populations to be able to access good care.
I know we've gotten a lot are still struggling with transportation, and they certainly many that I had phone calls with often felt that very aloneness, and because of being afraid to start off with, they even were afraid to even get their groceries. But fortunately, as things have progressed, their tensions have eased a bit more and that kind of thing. But so in that respect, I think as more people are becoming vaccinated, more people are relaxing a bit more as well. Research has shown that sexual and gender minorities are more vulnerable to becoming infected with the coronavirus, and are there more so likely to become severely ill from infection. What are the explanations behind this disparity?
Well, I can take it. So again, I think, especially sexual minorities, again, traditionally have had, rejection and mistreatment from, healthcare in general. And so a lot of times these individuals tend to maybe push off their annual exams, or if there's, something wrong, really waiting until, things are more emergent rather than trying to take care of them proactively. And so as these individuals, take on potentially, riskier behaviors and not seeking out healthcare and such, sometimes the amount of health comorbidities, add up on top of each other. And when they're not well controlled, it does make the body a lot more susceptible to, when you're having an actual illness, having a much more severe illness course. And I think that that plays a pretty significant role why we see some of those disparities. Also, again, these may be individuals that, don't have as much privilege, as much opportunity, for, career advancement and financial freedom. And so these things also put, higher stressors on individuals. And we do know, we have studies that are coming out, in modern times that is literally showing that stress kills people. And so as you start adding these different layers of stress, financial and health stress, and, the stress just on socially and what, how the world has been in the last year and a half and two, and then add on the additional stressors of being part of a sexual or, ethnic minority, it adds up pretty quick.
Yeah, I can see that, especially, when people are afraid maybe even go out to the office because of those. They figure we'll leave that to those that are actually sick with the coronavirus, and I'm afraid to go out. So in that respect, yeah, it does open them up to a whole new avenue. And with that heightened level of vulnerability in mind, why has the vaccine hesitancy been so prevalent within the LGBT community, do you think? Or what are concerns associated with this hesitancy?
I think it has to do a lot with what Dr. Block is talking about, a lot of medical mistrust in the community in general that goes back a long way, as probably leading to the same mistrust with the acceptance of the vaccine, especially when we're relying on the government and a lot of funding from the government to develop these things. And as a community, we haven't seen the government protect our community as much as we would like. So I believe that's where a lot of these hesitancies are coming from.
And probably so, but more recently, even before some of our suggested questions here were posed, since then, as we all know, the Johnson & Johnson vaccine has been put on pause. And some could discuss their hesitancy towards it, but personally, to me, it speaks volumes to the level of safety that we want to put behind it, simply because prior to now, almost 6.7 million vaccines have been distributed, and yet because of 6 persons that have shown a reaction to it, not to diminish their reaction, but at the same time, that just goes to prove that the level of safety that we want to go to show that we'll put a pause on it for further research. ideas or comments?
Yeah, I think the pause on the Johnson & Johnson vaccine, yeah, I agree. It shows the level of commitment and safety that the CDC really is putting forth in thought. It's very easy for people to throw a generalized feeling about the government and such. I do really think the CDC has people's health at heart. I can definitely speak for sitting on the board of health. It was really hard for us to make any decisions to close down any of the businesses. In fact, we waited until things were looking pretty dire before we really said, life, life over, economic stability for people. And we know that caused the businesses to shut down permanently, and people were struggling with bills and people not being able to pay their rent. But on the same token, we know that this virus is mostly transmitted through aerosolized particles, so particles that we breathe out. And the only way to really slow it down and stop it is to stop transmission, stop contact between, people. And so, some of those, some of these meetings, they're small meetings and such, and they're not publicized. But from personal experience, those are things that we took, very, very seriously. And as we're able to, that's part of the reason why we want these vaccines out. We want people to be able to open up bars and restaurants and stores again, and we want people to socialize. We need that sense of community in all communities, minority or majority, just to help support each other, reduce stress levels, and actually improve, health and wellness. So I think that the CDC is really being responsible. Anytime that we only have a few cases that are coming out, there's potentially quite a few other cases that perhaps have not been reported. And I don't think that we're going to find a tremendous amount. The studies and the safety data would not have allowed this vaccine to move all the way to emergency use authorization if there was significant harm. As I try to tell a lot of patients that are suspicious, we already have a virus that's very good at destroying lives and killing people. Why would we want to introduce a vaccine that would do the same?
Yeah. So basically we're saying with the safety levels at an all-time high, that means that the vaccines that are available are certainly ones that should be sought out at the earliest convenience for all. Are there any other insights behind the safety or behind the development of the COVID vaccines that perhaps where people thought that steps were taken or too quick to that you want to address or?
Mm-hmm. So, Randy, just for fun, how long ago do you think that these mRNA technologies were first thought about?
Well, we actually know that was actually with SARS quite some time ago. Yeah.
Yeah. Well, I didn't even know until I was doing some really deep diving. But this field of study was really first taken a look at in about 1990. So, not to place dates or anything, but I was only about 4 years old, when this was first being looked at. So the original scientist, her name was Dr. Catalan Carrico. And, originally it was interesting. This article was talking about how she couldn't obtain government funds or research funding, and almost lost her position, within the university, just because her research really wasn't going anywhere, because what need was there for this kind of technology? Fast forward to SARS in 2003, these companies, BioNTech and Moderna, were actually the first companies to start working with the mRNA vaccination technology. Now, why did we never see anything from SARS or when MERS came out, which was the Middle East respiratory syndrome, and that was in 2012, 9 years later? Why are we just seeing these vaccines now? Well, that's because when you look at geographically, it was in Asian territories where we saw these epidemics start. They were well contained. We've heard about them, but we never saw SARS. We never saw MERS in Europe or Africa or Australia or, North or South America. So because of this, none of these vaccines actually ever came to market. Fast forward to COVID, which is also known as SARS-2, it definitely crossed the thresholds and became a true pandemic, which means that we've got high rates of infection, all over a very large area, basically the world. So that's why it seems like this is a brand new thing. It takes about, I believe, 2 to 4 weeks for scientists to actually program the specific, RNA code that we're looking to make in these vaccinations. So while the base themselves, the science has been around for, decades, we're actually able to craft a specific vaccine with our current technologies in, 2020, 2021, and be very specific very quickly. So these really are not truly new vaccines and have a lot of background safety data with it. We've seen a tremendous safety profile so far to the mass population that has been immunized. I was probably one of the first in the region. My first vaccine with Mrna was in December, and second one towards the end of January. I maybe had, I won't lie, I had a pretty rough 24 hours after my second vaccine, but then 24 hours passed and I was back to normal. I would take that over any of the chances that I've seen. And there are people younger than I am with no health problems that we've seen dead in 3 to 5 days from complete respiratory destruction. I would rather take a day of feeling kind of crummy, which is basically just my body telling me my immune system is working. So the safety concerns, I think, I think people really just need to dig into the history and understand the research. And if it's not your specialty, which I totally understand, turn to your medical students like Nick. They tend to be sometimes smarter than I am because they're right thick in, all of the fields, all of the research, and learning the most up-to-date information. And hopefully the other, health practitioners out there are trying to keep up. But, turn to us rather than turning to Facebook and just reading somebody's opinion.
Yeah. I myself had very good, I think everyone's experience with the shots has been a little bit different. Myself, with the first shot that I had some soreness in the arm for 3 days, and then I was good. When I took the second one, I was prepared because I heard all the horror stories. I was prepared to be knocked out for 24 hours and everything else. And I had absolutely nothing, not even a soreness in the shoulder or at the injection site. So everybody's a little bit different in that regard. But in speaking of that, in other parts of our LGBT community, specifically our community of color, how does that intersectionality of identity play into this equation of hesitancy?
Yeah, I'll take that. Basically, we already talked about some of the things with the LGBT community, and that's even compounded with people of color. So you talk of access, economics, access to healthcare, and then just the pre-existing conditions that affect the Black and brown communities or minority communities. So that's already right there. So it compounds, everything gets compounded. And the statistics have shown like people of color LGBTQ are twice as likely to test positive for COVID than the white in the white community. So that right there just kind of compounds that. And then also with hesitancy, I think recent data or survey that I showed, it showed about 42% of LGBT community in general said they're very likely to get the vaccine. So that's across the board. But then when you talk about, for instance, the Black LGBTQ community, that reduces down to 29%. So that just shows the disparity there. And that goes back to some of the things we mentioned before about the mistrust of government, or people, the main concern I've heard was, oh, they rushed it too fast. So they already don't trust the healthcare system, the government, and then the speed of it. And also one interesting thing that I've heard and read is that the rhetoric of racism in the country by government leaders up and down, the spectrum has led to people not trusting also in the COVID response. They basically, like, they feel like if it was predominantly affected the white community, that would be there would be more of a bigger response and care. So they feel left behind in that sense, as well as people of color. And then, and you go back in history, and we talked about history, is the Tzatziki experiment back years ago has a lot of people in general, right, in the Black community concerned about not mistrust in the system, and any time you're talking with vaccines or treatment. So they feel like there's not the transparency there. So this just, like other things, just accumulates, the intersectionality just compounds things even more. And I think we also mentioned folks just being in general. I think one of the things is like doing this today is education, communication, because we have to build trust, especially in communities of color.
Well, we're going to continue our conversation about intersectionality a little bit, but I just wanted to remind everybody who is viewing out there that if you have any questions that you would like to ask anyone on our panel, that you can, at the lower part of your screen, click in the chat box and type any of those questions into the chat question, and we will have our panel gladly answer any of those questions. As we're talking further about intersectionality of our LGBT community, I wanted to also touch on our transgender folk. And is there any reason to believe that hormone or silicone injections or any kind of other things like that would have a poorer response to the COVID-19 vaccination or anything?
No, simply there's no evidence that hormones or any other substance that would have to do with body sculpting and reshaping would have anything to do with vaccine efficacy, side effects, etc. Through the mRNA vaccines, so basically they are a synthetic messenger signal that goes to the ribosomes, which are basically our protein factories in the cells. So the synthetic mRNA goes into the cell, doesn't go into the nucleus, which is where all of our cells store our genetic code. Goes to the protein factories, it makes the product that we're looking for, and then the cell degrades it. So there's no interaction or binding of the mRNA from any hormone replacement or any of that. The J&J and the AstraZeneca vaccinations are basically adenovirus based. So they've taken a virus that affects chimpanzees, I believe, but doesn't really injure or cause harm to humans, and repopulated that. If hormones actually helped prevent all of these upper respiratory infections, I'd be doing them too. But unfortunately, we don't have anything that actually prevents that from happening. So this is one of those examples where we can take nature and work with it a little bit to our advantage. So I feel that individuals who identify as transgender or have done any type of hormone replacement, active or in the past, should feel very safe and confident in getting these vaccinations without a problem.
Mm-hmm. Uh, some of the things that we've often heard with this is some of the various myths that are out there, and they are plentiful, and a lot of them are just things that you just have to laugh at. But just in case anyone takes those seriously, I guess we should be responsible and almost debunk or talk about them a little bit. One of which you just mentioned a little bit of how that the COVID vaccine could possibly change your DNA. Does anyone want to quickly say anything about that?
Yeah, so just to reiterate, the Pfizer and the Moderna vaccines, they don't even enter the part of the cell that has your, genetic code. And basically the cell breaks down the mRNA signal after it's made its products. The proteins that they make are basically simulating just a particle of the COVID virus, so that our immune system basically gets a dry run without having to actually fight the real virus. Because again, it's just a particle of the virus, it's not the virus itself. And again, I've had, my flu shot for at least 15, 20 years, and all of my vaccinations. I still have, as I tell my patients, I have 2 hands and 2 nipples, and it hasn't changed last time I checked. So I'll let you know if something changes in the future. It's simply just not true.
Yeah. There's the one where there's all kinds of weird stuff out there. But I thought maybe we should just debunk a few of them. What others have you heard that we know that we know of, people have suggested out there?
Let's see. I've heard of the vaccines really being mass produced by obtaining lung fetal particles and such. And we have some research that has been done, and some of our stem cells in our creations have been obtained from fetuses that had been aborted many years ago, but the cells themselves reproduce. So most of these, we use those cells to help us with some of our research and technology, but almost all the products that we are seeing, especially with the COVID vaccines, have nothing to do with that. I've also heard some theories that, Bill Gates is involved with this, and it's, they're trying to injure, certain people. And I don't know who has the time to make all of these myths come up, because I don't know. Those of us in healthcare are kind of busy right now.
Yeah, absolutely. On a more positive note, how has the creation of the COVID vaccine allowed us to make strides in establishing a more effective HIV vaccine?
I actually did a little research on this, and actually found a couple of articles that just came out in the past few days using, I believe that was partnered with Moderna through Scripps Research and the International AIDS Vaccine Initiative, I believe it was. They're trying to create a way to use the mRNA vaccine to activate some of our other immune cells that would help in recognizing the HIV virus, which I thought was very interesting, and it showed really good responses. I believe it was in the first phase of its clinical trial, and it showed a 97%
Wow.
effective rate. So I think that's very fascinating. They're also using this mRNA factor for cancer research and pairing it with a few antibody drugs that are already out there, and kind of creating that individual cancer medicine that I think has been long talked about, but kind of a fantasy in a lot of medical literature that we haven't been able to develop. And with the mRNA being so individual, being able to tailor that to each person's individual cancer could be something that is possible in probably not the very far future, which I thought that was exciting to read, and really makes me look forward to medicine in the future.
So it opens up a whole new door and a whole new window that we might expand other areas of our LGBT healthcare. Awesome. As we look to the future and beyond, to returning to normal, and to do that, I read that all wrong. As we look forward ahead to the future, how are we going beyond to return to normal and do I don't know what I'm reading. How do you feel about moving forward and going forward with our future together? We'll just reword that all together.
Well, one thing I'd like us to do in the future is lessons learned. That this has exposed a lot of weaknesses and gaps in our public healthcare system and our healthcare system, and also the lack of the social determinants of health data that needs to be explored more in the LGBTQ community. So gathering the data of the sexual and the SOGI data further, so that, because the CDC and any preventive health has already admitted that without this data, they cannot address the specific needs of the LGBTQ community.
Yeah, I think it has put a spotlight on a lot of our weaknesses, so that, and we're searching out ways to be able to repair those and to put some fixes in place. In the medical field, I know we've already begun to change a lot of our intake forms and that kind of thing. What other things have you guys experienced on that end?
So SOGI data, which is sexual orientation and gender identity, is just starting to hit the tip of the iceberg. I have my incredible medical assistant, Stephanie, is part of what makes, my practice really successful. And as an ally, feeling really comfortable at exploring questions with sexual history, as somebody sexually active, and, what gender or, do they associate with, and who do they have sexual relationships with, and do we need to be aware for screening? A lot of my patients are just kind of shocked. And they shouldn't be. This should be stuff that is so run of the mill. Yeah. I know you're going to ask me this kind of stuff. And so just starting to make it normal, make it something that we're aware about, having the CDC talk about, collecting LGBTQ data, and then bringing in medical students. So again, looking at Nick, who's just at the very tip of starting his career, and being part of a community forum about LGBTQ health. I mean, it's such a beautiful thing. That stuff was just starting to bud when I was in medical school, and now, the future is his, for the taking. And so I think that as we all work towards this, and making it okay to be part of, a minority and be proud of it, and to feel comfortable, talking to healthcare providers, that basically we take an oath to take care of everybody and to cause no harm. And that goes, regardless of who you are or what makes you different.
As we've talked about a lot of things that in our intersectionality of our LGBTQ community, one of the things that we want to address even tonight is the vaccine itself and where and how to get it. There are a number of places and that kind of thing that you can get, where you can get the vaccine and how you can make those appointments. Fabrice, I see, just joined us again. Or Dr. Block, if one of you want to even reiterate the clinic that's coming up on the 22nd, I'll let either one of you take it away.
Listen, Dr. Block has contributed so much already. I just don't want to scare him away. But it looks like that is really our main question, and not just making appointments, but also getting to the vaccination appointments, which is a great question. Thank you for submitting that. So it looks like I guess I have to mention our panel must have did a really great job because we don't have an abundance of questions to answer. But I will just jump into this initial question. So I want to encourage folks to definitely reach out, especially those who are local, to reach out to Public Health Dayton and Montgomery County and through our COVID-19 hotline at 937-225-6217. That's 937-225-6217. We will do our very best to get you set up with some of our internal vaccination opportunities, but also can promote what's happening within external groups at other hospital institutions or health institutions as well. So we'll make sure to give you that laundry list of where you can get your COVID-19 vaccination. I also want to encourage folks who have issues with transportation and who are just trying to figure out, how do I get to the convention center and some of these other vaccination locations? Our local RTA is doing wonders with getting our community members to their vaccination appointments without cost and without any kind of, without having to jump through too many hoops. You can call 937-425-8300. That's 937-425-8300 to find out about the different opportunities where you can either directly schedule to be picked up from your wherever you're at, that they will come to you to bring you to a local vaccination clinic. But it'll also let you know what routes may be on your way already, so you can just kind of hop in and be brought there directly. So we thank the RTA for just really accommodating the community's needs as it relates to getting to these vaccination clinics. And I have to mention again, on behalf of public health, the LGBTQ vaccination clinic that we are hosting coming up next week on April 22nd, Thursday, 8:30 a.m. to 11:30 a.m. at the Dayton Convention Center. This is specifically catered to our LGBTQ neighbors. No appointment is necessary for this free walk-up clinic, and no insurance is needed, and you will not be billed. So we're just really doing our best to break down some of these barriers that we've at least observed within the community in general, but also our LGBTQ community. So if we don't have any new questions being submitted by our viewers so far, that's fine as well. I'm just gonna knock it up to putting together the best panel that there's ever been. But I want to reiterate that this event is being recorded and will be shared on public health platforms, but also will be disseminated throughout the community. So if you have a friend or a family member who was not able to attend, we'll make sure to get this recording in your hands to make sure that they're able to benefit from this knowledge. So once again, on behalf of public health, I thank you all for taking the time out. I thank our panelists first and foremost. These are very busy people. Trust me, these are very, very busy people. And we definitely appreciate this amount of time that you've dedicated to this, a very, very important cause. And here at Public Health, we are just dedicated to making sure that as we pull ourselves out of this crisis, we're not leaving anybody behind. No matter what you identify as, or no matter what your lived experience is, we want to make sure that we are catering to your unique struggles and making sure your voice is not silent throughout our crisis response. So thank you again. We appreciate your time, and we'll make sure that this recording is made available to anybody who'd like to watch it at a later time. But yeah, enjoy the rest of your evening, and look out for Public Health and any of our additional vaccine messaging efforts and any other opportunities that we provide to really make sure that the knowledge is in our community members' hands, so that they're not just kind of having things thrown at them, but also empowered with information to make the best decision for themselves and for the county in general. So thank you again, and I hope to see hopefully some of you in person at a later date, but at least virtually. We're still grateful to communicate and interact with you all. So enjoy the rest of your evening. Thank you.
Thank you all. Thank you, panel, for joining us.
Absolutely.
Pleasure. Thank you for having this. Fabrice, thanks for all of your hard work. We appreciate it.
Oh, thank you for taking part. Could not have done this without you all. Thank you.